Hi, my name is Genevieve Curtis, and today I will be presenting on Family Systems Trauma Method, which is part of the Parenting with Love and Limits program. To look at the history of the Family Systems Trauma Model, we look at the beginning with Dr. Scott Sells. His first clinical job was at an adolescent psychiatric hospital, and he realized that he did not have the tools needed to treat the families that were coming into him. As one example, he shared in his book, Treating the Traumatized Child, a Step-by-Step Family Systems Approach. He was in a session with a 13-year-old aggressive boy and his mom. And in order to break some of the relational and communication patterns, Dr. Sells decided to use a technique called intensity technique. And what intensity technique does is tries to snap everybody out of their pattern by raising the emotional heat of the moment so that people will respond in a different way. Well, so Dr. Sells decided to tell the mom to forcefully and strongly tell her son what was expected of him and what would happen if he did not do what he was told. Once she was finished, the 13-year-old boy decided to spit in Dr. Sells' face, and Dr. Sells reached for his book to see what was next. What should he do next in the session? He looked through his book and decided that there were no answers. He couldn't find anything. He looked at the mom and said, "I just don't know what to do next." And the boy laughed and said, "See, he doesn't know what he's talking about." So as you can imagine, that was a very traumatic counseling session for Dr. Sells. Well, he didn't decide to stop helping the population that he was working with. Instead, he decided to create a system that would help field therapists deal with these situations with trauma and families. So it took him 8 years with his team to develop, research, and create the Family Systems Trauma Model, because like Dr. Townsend, Dr. Sells believes that any method or model that you use with a client needs to be based on good theory. So Dr. Sells started by looking at the evidence-based model of parenting with love and limits. He also looked at emotional focus therapy, trauma systems therapy, and family traumatic stress therapy. And although there was good information and good techniques for trauma with individuals, there was no techniques or systems in place to help families in trauma situations. Dr. Sells was also involved with research related to adolescent human development and family systems. He was part of a pilot program that researched family-oriented psychoeducational curriculum to help families. And in this research, they found that adolescent substance abuse is linked to dysfunctional family dynamics. So there's no surprise there. And ironically, adolescents said that the biggest help that they had was with family support to quit substance abuse and to stay sober. And so if you have a dysfunctional family and you need family support to improve your situation, you can see how that can be a problem. Another study showed that parenting styles affect adolescent development. So if you have a parent who is warm and has good, mature emotional stability, then the adolescents are more likely to be more competent and have better autonomy. Of course, conversely, if you have parents who are psychologically controlling, then adolescents develop a very intense feeling of unworthiness. And then the last research that I found about effective parenting includes parental monitoring and respectful behavior. So all of these are going to be very important foundations for the family systems model, family systems trauma model. So we heard trauma informed, which means that a therapist is realizing that trauma can be at the base of many behavioral and psychological problems, and we can help clients talk about their trauma and start to understand how the trauma is affecting them. But then what do you do next? Now what? Well, the answer to that is to be trauma responsive. So that means we're not just going to talk about the trauma and how the trauma makes you feel, but now we're going to help the client to take action to get beyond the trauma, and so that they can continue with their life. One of the ways the family systems trauma model does this is by giving the therapist a roadmap to be trauma responsive. And one of the things that Dr. Sells noticed was the difference between the first order change versus the second order change. The first order change happens when we're dealing with surface behaviors and surface problems, and we may be able to fix or control those behaviors and make it more comfortable for the family, but without dealing with anything below or what's causing those behaviors, the changes are not going to be permanent, most likely. A second order change is when we actually get to the issue that is causing the behaviors and the problems in the family or with the individual. And the second order change has been shown to be a more permanent solution that can be used as a life skills during an entire lifetime. And the second order change in this context means that we're then healing the trauma underlying the inappropriate behavior. One of the most exciting things that I found while I was researching the family systems trauma model was how closely it related to the Townsend character and competency model. So you can see the family systems trauma model teaches families to build their relationships and make their relationships better, which is the foundation of attachment and bonding that we need in order to grow in other character areas in our life. Without that relationships and bonding, it's very difficult to move on to any of the other stages in the character model. Family systems trauma model also respectfully listens to each point of view of the family, so they learn to respect and hear the other people in the family. Even if they aren't agreeing on it, they can still be respectful, which is correlated with the separation and the boundaries. So the adolescent then has the ability to start separating and have their own thoughts and feelings so that they can start becoming their own person. And the parents can help that develop in their adolescent by maintaining proper boundaries while there are family discussions going on. The family systems trauma model also teaches the family how to accept each other and also how to accept the world and the good and the bad that it has. which definitely goes with the Townsend model with integration and reality. Instead of a parent looking at their child and always thinking, oh, this child is always messing up, this child, it has a problem, and always looking at the negative, you can start to say, well, what good does your child do? My child is creative, my child is outgoing and friendly. And so it gives them a more integrated look at their child in order to help support that child. And then with the world, looking at the good and the bad, if there's a trauma that has happened to the family, whether that be a death in the family, a major car accident, or even some type of abuse that has happened, they can look at the world and say, yeah, a lot of bad things happen, and we can come together and deal with it and support each other in that. And we can also enjoy the good parts of being a family and enjoying the outdoors or playing games or whatever it would be that is good that we can take, and the joy that we can take out of life. And then the family systems trauma model teaches parents and adolescents to take responsibility for their own life and their own choices, which is, of course, the last part of the character model of adulthood and capability. And so parents get better skills and are able to improve their life and make better choices. And the adolescent is being taught how to take responsibility for their choices in life as well. Some of the techniques and strategies with family systems trauma model include identifying symptoms and setting goals. And you can see stressors is on there in parentheses. Dr. Sells has seen that stressors is a more easily used word for the families. They're more it doesn't have as much of a negative connotation to it as symptoms does, and so he gets better results when he uses the word stressors. And once that is done with the goals and identifying the stressors in the family, the next stage is working on the trauma in the family, if that is the case, if there is some. And also he found that wound work was better than using the word trauma work. Families were much more receptive when he used the word wound instead of trauma. So once that foundation has been set, then a collaborative approach between the therapist and the family to create a customized wound playbook to help the family move past the trauma and the inappropriate behaviors. The wound playbook is a way to set up the family to start moving towards a more healthy relationship. For example, one of the case studies in Dr. Sell's book, Treating the Traumatized Child, a step-by-step family systems approach, was a boy who kept running away from home. He was living with his grandmother and his mother. His grandfather had died of cancer a few years ago, and the tension in the home was really bad because the grandmother blamed the daughter for the grandfather's death because she was creating problems and issues which caused him to get the cancer and die. And so that tension constantly between grandmother and mother was too much for the boy, and he just kept trying to get away from that family situation. So in the therapy work, in the sessions, as they created that, created that customized wound playbook, they decided to use running as the foundation of what they were going to do by having the boy run a 5K in memory of his grandfather. And the grandmother's role was to make T-shirts with the grandfather's picture on it. And the mother and the son were to collect donations for the run before the run, so that it would be in honor of his grandfather towards cancer research. And then the grandmother and the mother were both there at the race, supporting and cheering on the boy. So this created a space for the family to start being forgiving and working together and honoring the grandfather, because all of them were traumatized by the grandfather's death. They all just had different ways of dealing with it. And so this playbook and the way they were able to come together helped them to repair the damage that had been done with blaming and other issues that made it difficult for the family. And one of the ways that the playbook can be beneficial and help the family to get through the playbook is to do role plays and dress rehearsals in the therapy sessions themselves. That way, like for example, before they went out, the mom and son would go out to collect donations, they could practice, pretending that they were knocking on doors and saying, hey, I'm doing the 5K run to help support cancer research because my grandfather died of cancer and I want to do something in his memory. And that way they can practice those kinds of things before they actually get out and do the practical work. And then as you're going through these steps, it's important to troubleshoot anything that isn't working well or needs to be tweaked a little bit to help people in the family feel more comfortable about it. And then also the relapse prevention is very important. Even though we're working on the issues and working through the trauma, it's not going to be the only stressor that happens in life. And so we need to help that family have tools and techniques in their tool belt so that they can deal with other stressors as they come along. So that relapse prevention piece is very important. And then, of course, once the family feels like they have completed and are able to move on, they have a graduation, which is a closure to the therapy and to saying, hey, let's celebrate, we've accomplished this together and we can move on together. And some of the reasons why it is so important to have the models like the family systems trauma model is due to the child mental health issues that are happening in the United States. According to the Centers for Disease Control, the CDC, approximately 20% of children in the United States experience some form of mental health issues. And according to the National Institute of Mental Health and America Mental Health, approximately 40 to 75% of children in the United States don't receive the mental health services that they need. That's a really big number. And then, of course, child mental health disorders cost society and families $247 billion annually. That's, again, another incredibly large number, considering that up to 3/4 of the children who need care aren't even getting that care. So that's why with parenting with love and limits, with the family systems trauma model as part of that system is so important because of its effectiveness. For example, 94% completion rate for parents when they are in the program, and 84% completion rate for adolescents. And 85% of adolescents did not relapse in the first year after treatment. Those are all really huge numbers, considering that other treatments can have up to a 75% relapse rate for substance abuse in adolescents. So you can see that cost-wise, be able to see a lot more families and children and get them to help with the same amount of money, because it's a short-term therapy, a brief therapy, as we've learned, a name for something that we want to be short and effective. And so as I've learned about the family systems trauma model, I'm very encouraged and happy to see that there is something that works so well and that can help families and the children that need the help in our country. One of the things that I forgot to mention when I was talking about adolescent human development is the fact that adolescents physiologically, we know the things that we can see that are happening with them with puberty and different changes in their body, but their brain also is pruning, which means a lot of the connections in their brain are being cut off, and so that there are fewer connections, but those connections are made stronger with myelination, which helps things get through the brain much more quickly. So they don't need a whole bunch of paths, because the paths that remain are more efficient and quicker and able to do things in a more adult fashion with cognitive behaviors. So there is a lot going on in adolescence, and even in a good home, there are lots of different stages and changes that are happening. And we need to be advocates, as we just learned in the town hall, to help families, help children, and be there to support our community as we try to make it a better place for all of us and help us all to reach that adulthood and reach our potential and help everybody to have a better life. So thank you for listening to my presentation, and we will see you soon.